Happy 4th of July. I'm coming to you with a solo episode. I wanted to share with you a special holiday message around the themes of independence and freedom. I'm also going to share with you a simple tool that you can use to gain more freedom in your life and get closer to the happier, healthier life you want. I think you're really going to enjoy this episode, and if you do, please subscribe to the podcast so you get notified of our future episodes.
You're listening to the St. Louis Pain Expert Podcast with Dr. Dave Candy, St. Louis's leading expert in chronic pain relief. Dr. Candy specializes in helping women age 40 and above to overcome chronic, nagging aches and pains without medication, injections, or surgery, so they can stay active, mobile, healthy, and independent. Whether you're suffering from pain yourself or know someone who is, pain's a universal experience that affects us all, but that doesn't mean you have to suffer. Knowledge is power, and having the right information can help you or someone you love get on the road to recovery. On the St. Louis Pain Expert Podcast, Dr. Candy talks with other pain experts from around the world to give you the information you need to recover, the peace of mind of knowing that you're not alone, and the hope that lasting relief from chronic pain is possible, and it doesn't require relying on pills, injections, or surgery in order to do so. So sit back, relax, and open your ears, mind, and heart, and let the healing begin.
Happy 4th of July. I wanted to share with you a special holiday message around the themes of independence and freedom. I'm also going to share with you a simple tool that you can use to gain more freedom in your life and get closer to the happier, healthier life you want. So first, what is independence? Independence is the ability to do something without having to rely on anybody else. And freedom is having a variety of choices available and being able to choose between those options. So what's the difference? In rehabilitation, we often use the term independence to refer to someone being able to, say, get out of bed without needing help from someone else, or walk without using an assistive device, or be able to go home safely without having to rely on someone else to take care of them. But once those basic needs of life are met, I would argue that most people really would rather have freedom than independence. That humans by nature are a very social species. We like being around people. Even from babies, we start naturally gravitating towards other people, mimicking faces. And largely people like to fit in as part of a group or a social group in society. Most people, given the choice, would not choose to be alone. But having the freedom and the ability to be independent, if it came down to it, that you could take care of yourself, that you could be self-sufficient, is something important to have. Freedom, on the other hand, is a little more contextually dependent. If you live in a society, there are laws and rules that even if you may be independent to do something, those laws and rules can limit your freedom to make those choices. Now, you might argue that you always have freedom of choice, that even if the law says something, you do have the freedom to choose not to do it. There are just consequences that come along with it. And understanding the consequences of choice is important in any decision that we make. This is not supposed to be a political episode, so we won't highlight the obvious arguments about freedom that have come to light over the past year, what people should or should not be required to do. Should we be required to wear a mask, not required to wear a mask, have a vaccination, not have a vaccination? It's been brought to light that although we all do share the same rights constitutionally, that there may be members of society who are not truly given those freedoms when it comes down to the de facto everyday life of the way things turn out. Again, this is not to take a position on any of those, but those are the things that come immediately to mind. What I want to talk about a little bit more in this episode is the limitations that we sometimes put on ourselves. Things that may be invisible prisons that keep us from living to our optimal capacity. Oftentimes, these come down to beliefs or rules that we learn when we're quite young, and those often carry through into our lives without us knowing them, just accepting them as fact or principles without examining how those principles might be applied to new situations. One example might be when you're very young being told not to talk to strangers, which is good when you're quite young, but if you carried that principle throughout your life, you wouldn't really be able to have a job, go to school, interact, go to the grocery store. You would be more or less required to be totally independent, to do everything on your own, which again, most people don't want. We are an interdependent society. So let's first examine some of those false beliefs and how those may hold us back. And we'll look at a variety of different contexts, but because this is a podcast about pain, we'll use a pain example first. So for a long time, people considered that the body and the mind were totally separate, and that what happened in your body happened in your body, and what happened in your mind happened in your mind, and never between should the two interact. Well, over the last 3 decades or so, advances in pain science have shown that the mind and the body are a lot more interrelated than you might expect, and that pain is really not a signal that our body sends to our brain, but rather it's a message that our brain sends to our body telling us, hey, there's some potential danger here. For example, if you stub your toe sends signals through your nerves up to your spinal cord, up to your brain that says, hey, pressure against the big toe, or the skin on the big toe has been ruptured. Then the brain has to process that along with all of the other past experiences of similar messages, similar environments, similar contexts, and decide, what should I do about this? Is this a big deal? Do I need to worry about it? Or is this something that I can just kind of brush off? Now, in each individual context, your brain may decide something else. That, let's say you've stubbed your toe 1,000 times before, and you know this is something minor. It hurts a little bit, but I didn't do anything major. Your brain will send out a message saying, don't worry too much about it. This will go away. In that case, you might experience a brief moment of pain, followed by quickly taking the weight off of it, moving around, not putting pressure on it for a few minutes, and quickly you start feeling normal again. This is a context where your brain tells your body to do appropriate things to take pressure off the area, and eventually it will return to normal. Now, let's say that you'd broken your toe in the past, and this time you just fell and stubbed your toe and it wasn't really anything serious. Now, your brain might have quite a different reaction saying, oh no, not this again. I remember what happened the last time that this happened. And the pain may be more intense. It may last longer because your brain is sending a different kind of response in response to the same stimulus that's come through. So we found in recent years that chronic pain is related somewhat to tissue damage, but there's actually a lot that goes on with how your brain has processed it in regards to what have I tried already. There have been lots of people that have tried to help me in the past, and it hasn't helped. Or my mom had degenerative disc disease in her back, and she ended up either in a wheelchair or having to limp around on a walker in order to be able to do anything. And I see myself going down that same path. And these are all things that would make the pain persist longer versus someone who had a first-time back injury and had never really experienced back pain before, nor had anyone in their family suffered horribly from it. Now, this is not the same as saying that pain is all in your head, because there are still physical signals coming in from your body saying there's pressure on the big toe, or in some cases, the ligament in the right elbow is no longer intact. Under normal circumstances, in acute injuries, the signal that comes from your body is the same amount of signal that reaches your brain. And then your brain processes that message and gives an appropriate response. Now, in cases of chronic pain, your spinal cord becomes more efficient at relaying those messages from your body up to your brain. And so the signal that is generated by your tissues is magnified through the spinal cord, and your brain still makes good decisions based on the information it gets and all the past experiences that you've had with pain. And it still produces an appropriate response based on the information present. It just so happens that that information may not be reflective of the actual circumstance of things out in the world. Now, what are some other thoughts and beliefs that can affect how long the pain will last? Well, anxiety and depression are two big ones that people who are anxious or depressed or have post-traumatic stress are much more likely to suffer longer with pain because the danger threshold is already elevated, that things already seem less normal. Another thing is past experiences with pain, that if you've had pain for a long time, if you've tried other treatments that haven't worked, if you've known someone who lost the ability to work or became disabled from a similar medical diagnosis as you have, that might make the situation seem more dangerous. And the pain can actually worsen the longer it goes on, even if the tissues are either healing or completely healed in some cases. And so it becomes a vicious cycle. So how do you reverse that vicious cycle? Well, there's no simple answer for every context, but it's a matter of managing the physical aspects of the signals that your body is telling your brain, as well as the processing aspect of what your brain thinks about it. And when I treat patients clinically, I assess both of those because sometimes it is a structural problem that needs to be fixed, and sometimes it's just that fear or beliefs are holding people back from doing the things that they need to do to get better and get back into the activities that they love. So how does that relate to freedom? Well, if you have the belief that pain means that something is damaged and that doing something could be harmful to that pain, it's going to keep you from doing the things that you need to do to get better, and it limits your freedom to recover. Now, what are some other false beliefs that form artificial prisons and keep us from doing the things that we really want to do in life? It could be with relationships. For example, feeling like you have to be something or someone that you're not in order to please someone else because of the false belief that you won't be good enough or they won't care for you if you act like yourself. If you've had troubled relationships in the past, perhaps an abusive parent or an ex-spouse, you may be fearful to enter into a new relationship. In regards to accomplishments in jobs or careers, if no one in your family had ever gone to college before, you may have the belief that I can't go. Or if no one in your family had ever been successful in business or in their career, you may have the belief that I can't do that either. Or having the fear to ask for a raise because maybe having a self-limiting belief that I don't deserve it. In regards to other health issues, if everyone in your family has had, for example, type 2 diabetes, you may have the thought that it just runs in my family. There's nothing I can do to control it. And so you may not even try. Or with smoking cessation, that there's no way that I can possibly deal with all these stresses. I need cigarettes to deal with all the stress that's in my life right now. Or if your doctor's told you that you have arthritis, you're just getting older, you're going to have to deal with the pain until it gets bad enough to have a knee replacement. You may see that as actually being your fate. But I know from seeing hundreds of patients with knee arthritis that only in a small number of circumstances is that actually the case. Humans lived for thousands of years before the invention of knee replacements. And still today, most people with knee arthritis are able to overcome their pain and get back to doing the things they want to do without needing surgery if they get the right type of treatment. So one exercise I want to leave you with for this 4th of July special is a way to challenge some of those beliefs if you notice that those are things that are holding you back in whatever area and keeping you from being truly free and happy with your life. And this isn't a physical exercise like riding an exercise bike or doing stretching. It's really more a matter of stretching your mind and opening your mind up to things you hadn't previously thought of. So the next time that you have some belief that may be holding you back, ask yourself these 3 questions. First, what evidence do I have that this belief is true? Second, what evidence is there that this belief may not be 100% true? And then third, what is a more balanced thought? So, for example, someone who's afraid of bending because their back hurts, and they're afraid that bending might make something worse, and they've been told in the past by doctors and physical therapists that bending is bad for your back. You should never bend your back. They may go on for years living without bending their back. Now, they might ask themselves, what evidence do I have that it's true? And that might be that I've bent in the past and that it hurt, that doctors have told me that I should never bend. Now, the next question would be, what evidence do I have that this is maybe not 100% true? And the answer to that might be, it's been 5 years since I've tried bending. I've been avoiding bending for 5 years, and the circumstances may be different. That there are lots of people who bend who have had back pain in the past, and they do just fine. So third, a more balanced thought might be, even though it has hurt my back in the past to bend, circumstances may be different now, and it's probably safe to give it a try. Now, if this doesn't apply to you, you may think this sounds kind of strange, but it is in fact the case that a lot of people with back pain are fearful of bending because they've heard that you should lift with your legs, not with your back, that you should keep your spine straight, that bending is bad for the discs in your back. Now, that's only one example, but you could apply this to just about any situation in life. So the next time you find yourself thinking some sort of negative thought, take the time to go through this exercise, and worst case scenario, you reaffirm to yourself that the negative thought is true. Best case scenario, you free yourself from that false belief and open up more options so that you can enjoy more freedom in your life. Now, if you can relate to anything that you heard on the episode today and you need some more information, feel free to reach out. You can email me at dave@stlpainexpert.com or give us a call at my clinic, More for Life, 314-941-3970. Hope you have a happy 4th of July weekend. Thanks for listening, and if you found this helpful, please subscribe to our podcast so you get notified of our future episodes.
Thanks for listening to the St. Louis Pain Expert Podcast. We hope you've enjoyed the show. If you live in the St. Louis area and would like Dr. Candy's help to find a solution to your pain, visit our website at stlpainexpert.com. Email Dr. Candy at dave@stlpainexpert.com or call Dr. Candy's clinical practice, Movement for Life, at 314-941-3970. Movement for Life offers free consultations called discovery visits to people who are serious about discovering how they can relieve their pain and get back to the happy, healthy, and active lifestyle they deserve. If you're listening from outside the St. Louis area but would still like some help, feel free to contact us to learn more about our virtual health coaching. Regardless of where you live, please share our podcast with anyone you know who would benefit from learning more about pain and what can be done to relieve it. And don't forget to subscribe to our podcast on iTunes, Google, Spotify, or your other favorite podcast platform so you get notified when we release a new episode. Thanks again for listening, and we hope you'll enjoy us again soon.